Ask Agatha. Dr. Agatha Thrash answers our questions concerning health problems that you or someone you know are interested in. Some of these topics include infant diet, cancer cure, is there one? Meat diet, is that meat good for you? Calcium, chemotherapy, is there anything good about it? Prostate cancer, kidney failure, is there anything you can do before dialysis is necessary? Menopause and arthritis. These are some of the topics Dr. Thrash spoke to us about. Dr. Thrash, have you always practiced medicine as you do now?
Before I changed my practice from the standard way to the way that we practice now with natural remedies, my husband and I, both of us physicians, both of us atheists, we had no religious faith of any kind. We had two major goals. One was to do as much good as we could. We were both humanitarians. We wanted to do good. And the second was to make a good living for ourselves, which meant to get very rich. Then we became Christians. Immediately, we began to feel that we had a responsibility more than just making a big showing in the medical world and getting wealthy. Now we felt that we had a responsibility to help people take more care of their own health and not just leave the treatment of disease to the doctor, but to become familiar with disease, reason from cause to effect, and put into one's own life the steps that would prevent disease. Go to the doctor and get the medicines after you've already become a cripple with some kind of disease. And so it was that helped us to recognize that we have a responsibility as physicians to be teachers. Now also, a thing that encouraged us here was that we could see that our patients kept coming back to us year after year, year after year. We continued to treat them with the medicines that we had until they died of their disease. We began to feel there must be a way to help people not have these diseases. And when we went into what we might call lifestyle changes and natural remedies for disease, it was then that we recognized that things that we had treated for years could never get the patient well of their disease, that we could cure them in a month or two. And the word was cure. It was not just that we had treated, but that they were cured. And so we would see people with diabetes or the complications of diabetes, such as diabetic neuropathy, or beginning to get diabetic retinopathy. If we could get them before they had the end stage of these complications of diabetes, we could usually turn them around so that the person did not have an advancing of their disease. So it's been, I would not go back to practicing standard medicine at all. I would stop the practice of medicine before I would go back to practicing in that way. It is so satisfying to practice in this way, where you see people actually getting well of their diseases and being able to take more responsibility for their own health.
What is the best diet for babies?
Of course, the best diet for an infant is mother's milk, and with nothing else until the age of 6 months. Then gradually, if she wishes, the mother can start introducing solid foods. By no means should she introduce wheat during the first year, because wheat is very likely to cause allergies, or dairy milk, or oranges, or raw apples, or unripe bananas, or strawberries. Those are all known to be very high allergy producers. And so these should be kept away from the baby's diet, kept out of the baby's diet until after the age of 1 year. After 1 year, she can introduce certain things if she wishes that may be in that list. But she should be in no hurry to introduce those things that are known to be high allergy producers. The diet of the baby when breastfeeding is stopped altogether. Of course, breastfeeding is still, after 6 months, principally the diet of the baby. And as breastfeeding goes down and table feeding goes up, and finally she stops breastfeeding altogether, the baby should be altogether weaned to the table. The baby does not ever need to take a bottle.
Is it necessary to give vitamins or mineral supplements?
Vitamins and minerals are not needed for a child. Animal products are not needed for a child. Milk, cow's milk, is probably injurious to a child. It seems that cow's milk encourages the probability of getting diabetes later in life and also getting obesity later in life. And so I would not use that. I would not use dairy milk and foods that cannot be chopped or ground to a small consistency, because babies do need to have their food ground or chopped so that before they get a full set of teeth.
If a mother cannot breastfeed, what are some alternatives?
If the mother cannot breastfeed, then of course the baby is somewhat handicapped. But in some instances, such as in adoptions of small infants, breastfeeding may be out of the question. But even there may be banks that have mother's milk banked, or there may be a wet nurse, a friend who has a small child who would be willing to at least give the adopted baby some breast milk, maybe not a full complement, but as much as the surrogate mother could provide for the baby. And then in addition to that, I would recommend a soy formula, one that has been specially formulated for a baby, not just soy milk that you buy from the shelf for adults. They will not be adequately formulated to provide all the nutrients that a baby needs. A soy formula can be used for such a baby. And then no vitamins and minerals need to be given at any stage, not in the newborn period nor at any later time, just the soy formula. That's the best. If soy is not tolerated by the baby, and some babies get terrible colic, lots of gas, much pain, and diarrhea, they cannot tolerate the soy formula, then what do you do? In my experience, if you have to go to an animal's milk, the best one is goat's milk and not cow milk. Cow milk is too far away from mother's milk for it to be tolerated well by a baby.
Is it necessary to give babies vitamin B12?
For a breastfed baby, the mother will provide B12 in the milk if she has adequate B12 in her body. So if she has a concern about that, she should test herself and see if her B12 level is high enough to provide for her baby as well. If the baby is on a formula, the formula will have B12 in it. So there isn't any need to administer extra B12. Now, as to whether an older child, let's say 8, 10, 12 months or 1 year or so, if there is any reduction in the development of a child, let's say a child is developing the skills that would be expected for that age, for the age of the child, then suddenly they begin to regress. They don't have the same skills that they had before. Then the child should be tested for B12. If it is low, it should be administered, because the baby may be permanently feeble-minded if B12 is not provided. In vegetarian adults, B12 may need to be administered. The darker the skin, the less the likelihood of becoming B12 deficient. The person who is most likely to become B12 deficient is the tall, blonde, blue-eyed person of North European extraction. They tend to have a stomach problem that's genetic, that's pretty much throughout all the part of Northern Europe, and they tend to get B12 deficient much more easily than do people who have darker skin. So it depends on the person, the kind of diet, how very clean they are. Some people do not allow themselves to have any kind of normal contact with germs. People who are psychotic, sometimes they will get B12 deficient just from the fact that because all B12 on this planet is produced by germs. So we have to get it one way or other. Some people brush their teeth 5 times a day. Well, the germs that produce B12 for the person who does not take any B12 source into the diet, they wash away all the B12 producing germs. And so they may need to take a supplement. The person who is B12 deficient may get a high homocysteine level or a high methylmalonic acid level. These are incompletely metabolized nutrients that build up in the body and tend to increase the likelihood that a person will get Alzheimer's disease and heart disease and cancer. And so a B12 deficiency can be serious, so it should be watched for. But the total vegetarian is no more at risk for these than the person who is a meat-eating person.
What is the best recommendation for a cancer patient?
First, I have to say that there is now no known cure for cancer. Not in the standard medicine, not in alternative medicine, not in the kind of medicine that we practice with lifestyle and herbs and nutrition and so forth. There is no known cure for cancer. If it's small enough that it can be operated on and taken out, that can be cured. But apart from that, there is no known cure. And so we often have some wonderful results with our lifestyle changes. And people who have big metastases, let's say for cancer of the breast, will often go years without a recurrence. Let me just tell you a case. We had a woman who came to us with a recurrent cancer. She had been operated on 4 years before, mastectomy. She had recently developed a little node under her collarbone, and that node grew until it was the size of an orange. It was at that point that she came to us. The reason she came was that she went to her surgeon, and the surgeon said, "You've already had all the radiation you can take. We've already given you chemotherapy. We could give you another course of that. And surgery is not applicable here because you probably have some other places too." She said, "Thank you very much. I'll just go home, set my things in order, get ready to die." So it was at that point that she came to us at Uchee Pines. Under our very eyes, we gave her some herbal treatments, change in lifestyle. She was overweight. We helped her to lose weight. We gave her hot fever treatments. She was a young and otherwise healthy adult. Very hot fever treatments, bringing her mouth temperature up to 103 to 104 degrees Fahrenheit. Under our very eyes, this big tumor shrank down to about the size of a walnut, and it sat right there for the next 5 years. Then the woman got depressed one June, went off our program, began to drink a little alcohol, did a lot of night clubbing, and was dead before Christmas. But she was stable, she had no recurrence, and I believe she would have lived another 5 years.
What are the main hazards of animal products in our diet?
Now, principal problems with a meat-eating diet are obesity, diabetes, hypertension, heart disease, cancer, because all meat products have cancer viruses in them and tend also to have pesticides in them because the animal concentrates in his body various pesticides in his feed to 100 times what a plant will have on it, just because the animal continues to store or to put away, try to get rid of these toxins from the blood by putting it in the tissues. And so the meat, milk, eggs, and cheese will have 100 times the quantity of pesticides that a person getting a vegetarian diet would get.
What can cause prostate cancer?
Prostate cancer, until the last maybe 20 years, was just thought to be something that certain men got. Now we know that it is men who are on a particular lifestyle. It's not just any man is going to come down with cancer of the prostate. Those who are overweight, those who have sedentary lifestyles, and those whose diet is, has a hefty amount of meat, milk, eggs, cheese, and fat. Free fats, that's like margarine, mayonnaise, fried foods, cooking fats, salad oils, and in some people even nut butters like peanut butter and almond butter and sesame butter. These may, in some people, have to be removed. Now the nuts themselves should be taken, but the free fats in the nut butters can cause a problem with encouraging or increasing the risk of getting cancer of the prostate.
Are calcium supplements recommended for people with osteoporosis?
I do not recommend to people who have osteoporosis that they take a calcium supplement. Calcium can be injurious to the body. It can precipitate out in the kidneys, in the blood vessels, in the heart valves, in the skin, in little places in muscles and elsewhere.
Is it true that certain feminine hormones are necessary to set calcium in the bones and to prevent cardiac disease?
The question of whether a woman needs to have female hormones for her bones and for her heart has been one that has had a good bit of controversy over the past maybe 20, 25 years or more. And no doctor knew for certain. That is, we couldn't just say, here is research that cinches this matter. I know now that I do have to give it, or I know now that I don't have to give it. We didn't have clear research until the last maybe 5 years. In the last 5 years, there has been a mounting body of research that shows that estrogens, over the long period, maybe for 2 or 3 weeks or maybe 2 or 3 months, estrogen may hold calcium a little better in the bones. But after that, it's even worse than it was before. So she loses not only what ground she had gained, but is even worse than, she's losing more calcium than she had before. So now, the consensus of opinion of those who have studied this is that calcium does not help to fix, estrogen does not help to fix calcium in the bones. Second thing with osteoporosis is that calcium is probably not the most important mineral to prevent osteoporosis, but magnesium may be just as important, and zinc may be just as important or more. And so we've been focusing on one thing, and in my opinion, that was largely because of the dairy industry promotional abilities that has sort of made everybody think the only place you can get calcium is from milk, and when a woman hits menopause, she's going to have estrogen in order to keep her calcium in her bones. But people lose calcium from the bones, everybody does, when they get past the age of about 50. Men do and women do. And besides that, little girls who don't have any estrogen, or 9 or 10, they're busy putting calcium in their bones every day without estrogen. And so how do they do that if estrogen is required?
Are steroids safe to use for patients with arthritis?
In my opinion, steroids for arthritis are actually contraindicated. Now, it is true that sometimes a person with arthritis will just have pain everywhere, and they are just nearly or maybe fully incapacitated with their pain. You can start with them giving them natural treatments, maybe a short fast if they have enough nutrient reserves. Give them a short fast, and usually a fast of 6 or 7 or 8 days will stop arthritis pain. Almost always, if you fast for 10 or 11 days, you can stop arthritis pain. And then you begin to add back a food that you think they will not be sensitive to, one at a time, every 5 days. And if they can tolerate the treatment, the long fast, and then the mono diet until you get the case under control, they will often not have to be given steroids at all. Steroids are bad news. If you are long-term on steroids, it's going to cause your bones to get thin, even to the point that just a little cough will break ribs, or a little bump will break a hip, or just being jostled in a streetcar will break a bone. We also use juices, yes, and the person with arthritis, if they're not, if they're not too bad, then I would select to give them juices, or a watermelon fast, or a grape fast, where the only food they take is grapes, or watermelon, or carrots, or juices. The length of time the person with arthritis has been taking steroids will determine how successfully you can approach taking them off steroids. It may be that you can get them off steroids, but if they've been taking steroids for 5 years or more, it's unlikely that you will ever get them off steroids. They'll probably always have to take them. The adrenals become dependent on the steroids, and any time you try to reduce the dose, they get a major flare-up and land in the hospital.
How does the nightshade family affect the symptoms of arthritis?
There are certain people who have a unique sensitivity. It may be only for them in their family. They may be the only one in their family who has a sensitivity to nightshades. There are certain toxic alkaloids in the nightshades that cause the person who is sensitive to them to have pain in their joints. These are alkaloids such as solanine, tomatine, conine, and many other toxic alkaloids. Most people can denature those easily in the liver, but there are some people who don't. And for these, they may fix to the tissues of the joint. And that means then that they are going to get pain. And so it takes a few weeks for all of those toxins to get out of the joints. So you take them off tomatoes, potatoes, eggplant, and peppers, the nightshades. And it may take you 2, 3, 4, 6 months before their symptoms go away. And they may tell you, I haven't eaten these good foods now for X number of months and I'm not one bit better. And then you say to that, oh, well, let's just go ahead and add them back to your diet. And let's add them back all in one day at one meal. And so you give them a soup that has tomatoes, potatoes, eggplant, and peppers in it. And the next day they're in bed and they say, I was better when I didn't take the nightshades. It may have been so gradual, and they are still not entirely pain-free. But when you give them a challenge, they may recognize, yes, I was much better. So sometimes you have to give them a test so that they can know it's important for them to stay off the nightshades. And not every patient with arthritis is going to benefit from it, but at least 25% will be improved, and 10% will be almost cured with this one thing alone, just removing the nightshades from the diet.
What can you tell us about chemotherapy?
Chemotherapy is no, don't take it. We don't have any effective chemotherapy. And if you ask anybody, for the commonest cancers, like cancer of the breast, if you ask any oncologist, what do you think about your chemotherapy? Well, I wish we had some effective chemotherapy. That's what they'll tell you. And then they'll say, well, doctor, what can you do for me? Oh, take my chemotherapy here. Even though they know it's not going to work, they know it's not effective, they will say, here, take this. I say that's wrong. If you know your treatment is not effective and it makes a person lose their hair, it makes them so that their gastrointestinal tract is sore from the lips to the anus, they are sick unto death, and many of them do die with their treatments, because what is done with chemotherapy is that chemotherapy is pushed and pushed and pushed and pushed and pushed until the person is nearly dead. Then they stop. If they gave any more, they'd die. Sometimes they don't quite stop in time. I say that's wrong. That's wrong.
Is hormone imbalance causing menopause?
The question that has plagued people who have studied the menopausal syndrome for a long time is, what causes these symptoms? Now, there's an interesting thing. We can give a woman estrogen who is having symptoms of menopause, and it will take them away, take the symptoms away. Does that prove that she was estrogen deficient, and that's why she got the problem with the hot flashes or depression or whatever? And the answer is no, it does not prove it at all, because you can do some other things and she will lose her symptoms. Does that mean that they were deficient of black cohosh or they were deficient of exercise? It may mean they were deficient in exercise. What we need to tell women who have menopausal symptoms is take plenty of exercise and breathe deeply, because one of the things that happens to a woman in middle age is that she begins to breathe more shallowly. And when she breathes more shallowly, that means that her nasal passages are not cooled by the air that goes up and around and down this way. Just behind the top part of the nasal passages is the thermostat in the brain. So if she is not breathing in deeply, then it does not cool that tissue which has the thermostat right behind it. And so the thermostat looks down and says, it's getting warm down there. Let's open up the blood vessels. And so it opens up the blood vessels on the skin, and she feels very hot because all these blood vessels have just opened wide. And also it says we need to, then when she gets hot on the skin, the thermostat says we need to open up the sweat glands and get some fluid out there on the skin, so she breaks out in a sweat. All that can be prevented if, when she begins to feel the hot flash, she starts doing a deep breathing exercise through the nose and out through the mouth. So it's in through the nose and out through the mouth, and repeatedly. In and out, in and out, pretty rapidly. She can do this when she's on a bus, when she's sitting on a stage ready to speak, when she's in her home she can do it, and nobody needs even know that she's having a hot flash. And usually within 10, 20 seconds, she can stop a hot flash. So I say get plenty of exercise, eat a good vegetarian diet. Don't eat a lot of free fats. Don't let your weight start going up at menopause. All of those things are known to diminish the lack of good exercise, not being on a good diet. All of these things are known to diminish the depth of her breathing.
Are there benefits for women taking estrogen?
Now, so far as the heart and estrogens, again, standard medicine has taught for the last maybe 20, 30, 40 years that estrogen is needed to protect the heart. And that when a woman gets to menopausal age, she should take estrogen because it will protect her heart. But now we know that it does not protect the heart at all. And estrogens and other female hormones have side effects that are very unwanted. Breast cancer and maybe brain tumors and other cancers, ovarian cancers, endometrial cancers, all may be, well, we do increase the risk in every woman of getting these kinds of cancers. So I say the side effects are really serious. The benefit is non-existent.
What can be done for kidney failure?
When a person has lost 90% of their kidney function, they will probably have to go on dialysis. So, and we have no natural remedies that can pull these nutrients that are now increased in quantity, such as potassium and sodium. We don't have a good natural way that we can pull those from the body. So we can be thankful that there is such a thing as hemodialysis. But before the person gets to end stage renal failure, we can take the patient and improve the kidney function so that they can live healthfully without progression of the renal failure. So what we try to do is prevention in these cases. We watch the individuals, do perhaps an annual kidney function test, such as BUN, uric acid, and creatinine. The most sensitive test that we have is creatinine. And so when the creatinine goes above 1.2, immediately I say to the person, we need to treat you in such a way that you will not get kidney failure. But let's say by the time I see the patient the first time, they already have a creatinine level of 2.5. Then the case is now urgent. Now it isn't going to be until the person gets a creatinine level of say up to 8 or 9 or 10 that they will need to have dialysis. Long before that, I want to be present on the case. They need to have a low protein diet. They need to have the things that we add used with great restraint, such as salt, honey, sugar, fats. Those need to be added with great restraint. And things that are very concentrated, foods that are very concentrated, such as desserts, chips, meat substitutes, and all animal products, meat, milk, eggs, and cheese. Those are all concentrated foods. The person needs to become a total vegetarian. It's the most favorable diet for them. And then even in the total vegetarian diet, they must be careful not to eat junk foods or any kind of food that would be irritating to the kidneys. Now, what are those foods? They are such things as spices. Now, we need to differentiate between spices and herbs. Herbs are usually leaves like mint or basil and things of that nature, which can be properly used. Oregano, maybe even things like parsley. Those are herbs, but the spices are ginger, cinnamon, nutmeg, cloves, black and red pepper. Those are the spices, and they can be irritating to the kidneys because anything that feels hot on the tongue but is not hot with heat can irritate the kidneys, provided the heat is not caused by an enzyme. Now, onion, garlic, and perhaps something like horseradish, I'm not sure, may have an enzyme. I know that onion and garlic and radishes have an enzyme, and horseradish may, I'm not certain about that one, may have, do have an enzyme that is quickly denatured in the stomach, so it does not get in the system to irritate and inflame the system. So the kidneys are not harmed by onion and garlic and radishes, which may be hot when they're not hot with heat. But anything of that nature must be totally removed. Vinegar, which goes in the mouth as vinegar, is excreted through the kidneys as an acid, or rather irritating acid. That's acetic acid. And this acid can irritate the kidneys, should not be used. Drinking plenty of water, getting plenty of exercise, not eating too much food. Just eating too much food can cause a problem. And of course, any disease that can cause kidney failure, like diabetes, hypertension, certain inflammatory states like the collagen diseases, all of these should be kept in perfect control so that the kidneys will no longer be damaged. Yeah, gout is another one that is very damaging to the kidneys. So the person who has any of these diseases needs to know that if they do not enter into a lifestyle that will put these diseases in perfect control, that they may be making an appointment with the dialysis person. With renal insufficiency, the things that you must do, number one, avoid those diseases, or put in perfect control those diseases that cause renal failure. They are hypertension, diabetes, certain collagen diseases and inflammatory states of various kinds. Those must be put in perfect control as well as can be done, and that must be by natural remedies, because we must also avoid drugs. All drugs that are excreted through the kidneys, which is most of them, those will damage the kidneys. And so just across the board, we need to say, drugs, for the most part, should be avoided. Any drug that can be avoided should be. And in our experience, we don't really have many drugs that we feel are just essential for a person to take. Perhaps some cases of epilepsy that we can't control, we might put them, but it's a rare person. In our practice, in our way of meeting the health needs of persons who require any pharmaceutical agents at all. So that's also a big part of it. Another thing is diet. It should be low in protein. It should be devoid of animal products, because all animal products put a tax on the kidneys. It should be free from all spices, such as ginger, cinnamon, nutmeg, cloves, black and red pepper. It should also be a simple diet. The person should not overeat. Every time a person overeats, it puts a great burden on the kidneys. When a person is overweight, it puts a burden on the kidneys. Alcohol is, that's a conclusion that anyone should be able to reach immediately. Alcohol is going to damage the kidneys, should not be taken. There are several medications that are known to be associated with kidney damage and to have as one of the complications of taking that medication that they may get kidney failure. One of those is certain antibiotics. So anytime a person is offered a drug, the first thing that they should do is to get the manufacturer's listing of the contraindications, the warnings, the side effects and complications that one can get from taking that medication. And I find in my office, people come to my office with a shoebox full of drugs often. And they say to me, these are my drugs. Aren't these good drugs, doctor? And I say, do you know the side effects of this one? So I just get my PDR, the physician's desk reference, and I look up their drug and I say, this drug has these side effects. Oh, well, my symptoms are nowhere near bad enough for me to be taking those risks. I'll put this one aside. How about this one? Turn in my physician's desk reference and I give the warnings and complications and contraindications and complications. And they say, oh, my symptoms are nowhere, I'm not sick enough to be taking these risks. I'll put this one aside. They give me one by one, and I go through this process, and often they go away saying, well, I'm not going to take any of these drugs. We should know, with every drug that we take, is this going to damage my kidneys? Does it have even a possibility of damaging my kidneys? If it does, then I don't need to take this. I can take something else for my symptoms so that it will not endanger my kidneys.
What can we do for kidney stones?
A very unconventional way to treat a kidney stone is one that my son did. My son had a kidney stone. And in my family, we are sort of kidney stone formers. My husband had several kidney stones, and my son has had 2 kidney stones. And we had tried every simple remedy that we could. We'd given him all the herbs, all the supplements, loads of water every day. He did exercise. He put compresses where we knew the kidney stone was. We took him downtown to a specialist in kidney diseases, a friend of ours, a urologist who'd been in practice for nearly 50 years. And he said, I've never seen a kidney stone this big that's passed by itself. You might as well just go ahead and make an appointment with the people who do the crushing procedures with the ultrasound type of things. You might as well go ahead and do the lithotripsy, but it's $10,000 every time you go. And he's, as big as his stone is, he'll surely have to go 2 times. Oh, $20,000. And my son didn't have health insurance. So where to get $20,000 for this procedure? So we were just, you know, trying to put a little money aside and hoping that we'd have enough money before his kidney was destroyed so that we could get it done. But then just really hoping that something that we would do would make the kidney stone pass. So the urologist said, now I tell you what it's going to do. It's going to come from the kidney down the ureter all the way, and when it goes across the pelvic brim, before it goes into the bladder, it's going to hang right there and it will never move. So we were giving him all sorts of things. He was a very cooperative patient. 9 months went by and it had stayed right there at the pelvic brim. It took it 3 weeks to come from the kidney down to the pelvic brim, and then 9 months it sat right there. It did not move. And then it was New Year's Day, and a friend of our family came, a great big retired military man who was really proud of his strength, and he came up to my son and he said, "You're just a little fellow. I could just turn you upside down and shake you." And whereupon he did that very thing. He turned my son upside down and gave him a little shake like this and then laid him down on the floor. 10 minutes later, my son went into the bathroom and passed a kidney stone. I don't recommend that as a real treatment, but now as to treatments that we did for my son. Okay, the way to treat kidney stones, it's a little difficult, but you should work with it beginning with the very first hint that a person has a kidney stone. First thing is plenty of water. The kidney requires much water in order to float the solid materials that come from the blood into the urine. It needs a lot of water for that. So the individual who is from a family of known stone formers, that individual needs to be always well hydrated. That means 8 to 10 or 12 glasses of water a day, depending on their activity and how much they sweat and how much they talk, and because talking makes us lose about 1 8-ounce glass of water per hour. And stress also makes us lose a lot of water through the skin and through the kidneys and through the bowels. And so the lifestyle of the individual will determine how much water the person must take. So we gave him a program of, we should give a patient a program of plenty of water. And then we use a little magnesium supplement which relaxes the ureter and encourages the stone to pass through the ureter down into the bladder. And we also use certain herbal remedies. We use stone root and gravel root and marshmallow root. Marshmallow root is a soothing substance. We use that. And other herbs as they seem to be indicated. If a person has something like a known spasm, then we will give hot and cold packs, alternating hot and cold packs. Big, thick packs kept on about 10 minutes, and then mild, cold applications for about 1 minute, about every 8 to 10 minutes, and do that for about 3 exchanges, and that can be very helpful for pain. For the acute flare-up, we may put the person in a neutral bath, and they get good relief from that, just sitting in a bath of neutral water. And they will tell you right away when they sit in the tub that they're feeling much better already. Sometimes they will have to sit for hours in the bathtub with just water at a little bit above body temperature so that they're just comfortable, and they do that for as long as it's necessary to control their pain. Then we also may try to give a flush, which is to give an extra dose of magnesium salts like magnesium citrate, magnesium aspartate, or even Epsom salts, and then flood the person with all the water they can possibly drink. And we try to have them drink about 2 liters in 1 hour. And we do that for 2 hours. So we try to get them, if they can take it, about 4 liters in 2 hours. That floods the kidneys, and of course they need to be passing their urine all the time. And we strain the urine to see if they do indeed pass the stone. So that's our treatment mainly for that. It's hydrotherapy, herbal remedies, and good lifestyle.
Are there any health risks from taking drugs such as aspirin or Tylenol?
Any kind of medication that a person takes that they self-prescribe, such as Tylenol, which is very bad on the liver, not so bad, but is also bad on the kidneys, and aspirin, which is bad on both the liver and the kidneys and the arteries and the heart and the eyes. It is now known that macular degeneration, which is one of the principal causes of blindness now, apart from injury and diabetes, macular degeneration is the #1 cause of blindness. Aspirin is known to be a factor in causing people to get tiny microscopic hemorrhages in the macula, which can then lead to reduction in vision and eventually in blindness.
Are there any drugs available to bring the cholesterol level down safely?
In no instance is there a drug that can be used to bring the cholesterol down that does not have unwanted side effects. And many times these side effects are more harmful to the body than having a high cholesterol would be. And so I recommend that the person who has a high blood cholesterol, that they be put on a lifestyle program to bring the cholesterol down. Many people have a genetic or a familial type of high blood cholesterol. It's difficult to work with these patients. They need to be on a totally vegetarian diet, which is the most favorable diet for high blood cholesterol. That's right off the bat. Second thing, they need to have no free fats: margarine, mayonnaise, fried foods, cooking fats, salad oils, and in severe cases, no nut butters even. They must eat nuts, but the nut butter is handled, the free fat is handled in the body in a way that makes it more likely to have the person produce more cholesterol in the body. So we take them off free fats. Then just exercising, getting sunshine will bring the cholesterol level down. And in severe cases, you can give charcoal, which does not harm the body in any way. It does not actually act on the body's cells. It simply passes through the gastrointestinal tract and can take with it certain waste products. It can also take cholesterol that's not protein bound. It can pick up some of that. It can also take up any toxin that the person may have taken, and it just simply takes it out of the body attached to the cholesterol, to the charcoal. So we give charcoal to treat these people. They can also use a high fiber diet or even take some extra fiber, which attaches cholesterol and takes it out of the body. Reduction of stress will also reduce cholesterol, because stress requires, to make the hormones of stress, requires cholesterol as a substrate for the making of stress hormones.
Is it safe to lower your blood sugar with herbs?
We know that there are certain herbs that can encourage blood sugar to be pushed into the skin. Still sugar, it's not the amylose that we know the person is going to produce. And it's as glucose still. It can also go into the liver, into the kidneys, into the muscles as sugar. It's not used, it's just sort of stashed away there or stored there temporarily so that it can get it out of the blood. Because if the blood sugar keeps going up, the blood will become sluggish and heavy, and that makes a grave difficulty for the body when the blood starts being sluggish. And so the body must get rid of the sugar out of the bloodstream, and then little by little it will accept it back in, as it then stores it rather permanently as the storage form of sugar in the body. The type 2 diabetic does not have a deficiency of insulin. They have a surplus of insulin. But the problem is that their cells have become resistant to the insulin, and so they cannot use the insulin that they have. But insulin is a very heavy-duty hormone, and as it goes up in the bloodstream, it literally irritates or damages cells that it touches, like the interior of blood vessels, like nerves, like the skin. And so these individuals tend to get blindness whether or not we have diagnosed diabetes. They tend to get neuropathy whether or not we have diagnosed diabetes. Yet diabetes is going to be diagnosed in another few months, but often the thing that alerts us to the fact that the person has insulin resistance is the fact that they are getting the complications caused by diabetes, and yet they don't have diabetes yet. Their vision is beginning to get blurred, their legs are beginning to hurt, their skin is beginning to get infections, their arteries are beginning to get hardening of the arteries, and even so, they have not yet been diagnosed with diabetes. So we say that herbs are not the answer. Lifestyle is the answer to type 2 diabetes.
Could patients with type 2 diabetes use natural treatments to be liberated from insulin dependency?
We have had many patients with type 2 diabetes who have come to our institute already on insulin. Maybe they're taking 80, 90, 100 units a day. Usually, within 3 weeks, we can get their insulin level down to maybe 10, 20 units a day. And as we continue to follow them, the 3-week period is the time that they are actually in our institute as residents. And usually over the next 6 months, following our program, they can become completely insulin-free. And that's regular and routine. We expect it. Now, for a lot of people who come to our institute, they'll be off insulin in 3 days. Mm-hmm.
So, Dr. Thrash, are you saying that a vegetarian diet is good for the person with gallbladder problems?
Yes, it's a good vegetarian lifestyle, low or devoid of free fats like margarine, mayonnaise, fried foods, cooking fats, salad oils, and nut butters even, for the very susceptible person. Yes, I'm saying that a good lifestyle will keep the gallbladder quiet.
Is there anything you would like to tell us about gallbladder surgery?
Now, most surgeons will tell you that if you do not operate on a gallbladder that has gallstones, that it increases the risk of getting gallbladder cancer. That is a fact, but it is also a fact, and we surgeons don't generally like to think of this, but our procedure, our surgical procedure, also carries with it a mortality rate. Your likelihood of dying with a cancer of the gallbladder is not quite as great as your likelihood of dying of the operation for gallbladder. So I say it's probably better for us to try to change the lifestyle and get into another program that will not continue to form more gallstones, and let the person simply keep the gallstones that they have and try to have a healthy gallbladder despite the fact that they have gallstones there.
What causes hypertension?
There are 2 principal types of hypertension. One is called secondary hypertension, which is caused by something that we know, such as kidney failure. And the other is called essential hypertension, which until recently was not known as to what its cause was. Now we know. Essential hypertension is a combination of a number of factors, but the underlying factor is insulin resistance or insulin insensitivity. And the thing that is involved there is a genetic or familial propensity to get insulin resistance, plus eating too much. When a person eats too much, they may get overweight, but even if they just eat too much, their body cells are going to have fewer openings where they can take in insulin. When these mouths or ports shrivel up and die or go back into the cell, and you should have maybe 40,000 of those for insulin when it comes around to get into easily, you may have only 2,000 of those. Well, that means when insulin, which is attached, and I'll make it very simple, it is as if insulin is attached to sugar or glucose and finds one of these ports, and insulin comes in, and when it's drawn back down into the cell, insulin is drawn back down into the cell, it brings with it glucose. And that's how the cell is nourished. So when these ports are not there, the cell is starving, even though in the bloodstream there is plenty of glucose. So it's a starvation in the presence of plenty. And so many cells are damaged by too few insulin receptors on the cells. And in some some instances, people express that as hypertension. In other instances, they express it as diabetes. In other people, it will be expressed as high blood triglycerides and maybe high blood cholesterol with a low HDL cholesterol or high density lipoprotein cholesterol. The high density lipoprotein is the protective one, and the low density lipoprotein is the one that damages you. So you have a low protective one and a high damaging one. And so the cholesterol is thrown off, diabetes may occur, hypertension may occur, it increases your risk of getting cancer and also overweight.